We and others have tested different animal models of acute pain and chronic pain, including inflammatory pain after arthritis, post-operative pain after surgery, and neuropathic pain after nerve injury, spinal cord injury, and a traumatic brain injury, and as well as diabetes and chemotherapy-induced pain. Yes, we have demonstrated a potent analgesic effects of these SPMs, including resolving family, protecting family, and also morassing the family. So compared to traditional analgesics, these SPMs are very potent, and they can be used at a dose of 1,000 times lower. So also they have no side effects, to my knowledge, in all animal models we have tested. We think these SPMs can act on different receptors on different cell types. And for example, they can act on immune cells to promote phagocytosis of macrophages and promote resolution of inflammation. They can also act on glial cells in the nervous system and to control neuroinflammation in the central nervous system. And they can also directly act on neurons and to modulate critical ion channels, such as TRP channels, for the control of pain. And there are multiple mechanisms, so well demonstrated for its immune modulation, but we also know now it can play important role in neuromodulation, and we know and there are many human pain conditions associated with, for example, diabetes, chemotherapy-induced neuropathic pain, traumatic brain injury, and SPMs and some they have very potent effect not only in the immune system but also in the nervous system, and they can be ideal for treating human pain conditions, such as diabetes and traumatic brain injury, spinal cord injury, nerve injury. We and others have demonstrated a potent anti-pruritic actions of SPMs in acute and chronic itch models. Acute itch models include histamine-induced itch and also opioid-induced itch. Chronic itch models including in different dermatitis model, and recently we also developed an animal model of cutaneous T-cell lymphoma, and these animals are very itchy, they scratch a lot, and we have demonstrated and some SPM analog is very potent in reducing scratching behavior. So animals scratch much less after even local treatment like topical application to the skin. So we are excited about this finding. So SPMs are well known for its pro-resolution effect. It can promote the resolution of acute inflammation and acute pain, and therefore it can prevent the transition from acute pain to chronic pain. Traditional pain killers such as anti-inflammatory treatments and steroid, and also non-steroid anti-inflammatory drugs and NSAIDs such as COX-2 inhibitors, and they can control acute inflammatory pain, but they will also impair the resolution of inflammation, and therefore they may cause chronic pain. And opioid, we know, has a variety of side effects, including addiction and respiratory suppression that may lead to death. So opioid also known to cause other side effects, such as constipation and also itchy pruritus. And still now we don't know how SPM system and opioid system interact, but we have some evidence that some SPMs can also alleviate opioid-induced acute itch. Yeah, there is an ongoing opioid crisis in this country, and in certain years, over 100,000 Americans are killed every year by this opioid crisis. And NIH has this HEAL initiative with a lot of funding and to solve this issue, because many patients started with the pain problem, and when before they seek an opioid, and then, as you know, opioid can cause a lot of problems, including addiction and sometimes and even death. So this I think is a great alternative as a non-opioid pain therapeutics. Actually, this HEAL initiative from NIH is trying to promote non-opioid analgesic for the control of chronic pain and also transition from acute pain to chronic pain. Yeah, we are very excited about this emerging resolution pharmacology, and because there are different types of SPMs, and there are different types of receptors, and we think these receptors are expressed by different types of cells under different pain conditions or disease conditions. So therefore, there are emerging number of targets that can be used for the control of pain and resolution pharmacology.